My name is Rachel Fox. I'm a medical student and a health equity scholar at the VCU School of Medicine. I'm also the founder and president of VCU's chapter of Students for a National Health Program, the student branch of Physicians for a National Health Program. Before medical school, I worked in health policy on Medicaid expansion and financing, so I've seen our healthcare system from a few different angles, which has only reinforced to me the necessity of a single-payer system like Medicare for all. While the widespread American mythology says that private insurance is somehow more efficient than public, I've witnessed time and again how untrue that is. I currently have a patient who is medically cleared for discharge but has been sitting in the hospital for 2 weeks, only because their insurance company is refusing to pay for their medically necessary inpatient rehab program. Shame. Meanwhile, that company spends 6 times as much of its budget on overhead costs as Medicare does, which maintains just 2% operating costs. So why are we wasting time and resources on this nonsense? I don't want to be a doctor to boost shareholder value for United Healthcare. I don't want my future career to be in a health system where I have to consider the whims of a profit-seeking insurance company in my clinical decision-making. I don't want our increasingly corporate and consolidated health system to push even more rural hospitals out of business and strand rural communities like my hometown an hour away from the nearest hospital. I definitely don't want to be a patient in our current health system where no one my age has a primary care physician because it is impossible to find a provider who is nearby, who takes your insurance, and who can see you in a timely manner, even in the Virginia state capital where I live. Our current health system benefits nobody but the private companies it was designed to benefit. We can't afford to keep paying private insurance companies to rip us off, and single-payer healthcare is the only viable long-term solution to our current healthcare crisis. Thank you. In the wealthiest, most powerful country in the world, healthcare should be for everyone, and Medicare for all is the way to get there. Thank you all so much for your time and for your hard work fighting for what's right.